Welcome everyone to December's BayCare Presents. We are very excited to have you here today. We're going to learn about the importance of sleep, how it affects your body, what we can do to make better sleep for ourselves, and if you are having problems, where to go. And I am going to turn it over to you.
Absolutely. Well, sorry about that, and thanks to everybody for their patience. As Jean Marie said, I'm going to be talking about the importance of sleep and some of the sleep conditions we see as ENT physicians. So my name is Desai, MD. I'm part of a group called ENT Associates across Pinellas County, and I practice primarily in the Largo and Clearwater area. I don't have any financial disclosures. We talk about several different products, but none of them in which I have any financial interests. So a little bit about me and my background and how I got interested in this topic. So I trained at the University of Miami for both undergrad and medical school. Later went to the University of Texas Southwestern in Dallas for my head and neck surgery residency. Over the next 5 years, got interested in sleep medicine and eventually did a fellowship for subspecialty training in head and neck endocrine surgery at Hopkins. And then I joined practice here in Clearwater with ENT Associates. And so all of us see a lot of sleep apnea and CPAP patients. For a variety of issues. And some of us also perform surgical procedures for sleep apnea. And we'll talk about that in brief at the end of the presentation today. So let's review a little bit about the basics of sleep. So sleep is a natural and temporary state of rest where an organism becomes physically inactive and relatively unaware of their surroundings. And despite the physical inactivity, the brain and many body systems are very active during this period. And we know that this is essentially required for existence for any animal, as every study animal sleeps in some capacity. So there must be some restorative effect, and we've known that for many years. Now, the amount of sleep an animal needs is dependent on their role in the food chain, their metabolic rate. In general, some of the larger animals like giraffes and elephants tend to sleep a little bit less. Humans sleep on average anywhere from 6 to 8 hours. And then sometimes smaller animals tend to sleep longer. On the high end are brown bats and koalas. And if you look at this at first glance, you may think that sleep is kind of an evolutionary liability. It's a period where we're not protecting ourselves, we're relatively defenseless, we're not actively searching for food or for social company or anything else like that that may have some evolutionary benefit. But we know that sleep is very healthy for us and has numerative benefits. And these have been studied extensively, but we know it helps with cognition, memory consolidation, that's turning short-term memories into long-term memories and kind of registering those in the deeper parts of the brain, immune functioning, emotional regulation, creativity, and finally mental and physical performance go up with adequate and sufficient rest. So we've probably all heard about the circadian rhythm. This is our body's internal clock that tells us when it's time to sleep and essentially regulates different portions of our body temperature, our blood pressure and vital signs, our hormones, including testosterone, and melatonin is one of the main chemicals that regulates this. So this is regulated by a portion of our brain called the suprachiasmatic nucleus, and that regulates the pineal gland, which produces melatonin. And that's the body hormone that you may have seen as a supplement that helps tell us when it's time to sleep. And that process of circadian rhythm throughout the day, keeping us on schedule, helps explain why some of us get jet lagged when we travel. So when you cross multiple time zones and you go to the other side of the world or a different continent, all of a sudden your circadian rhythm doesn't fit the daylight, sort of clock that we all have built in. And so it's not just that you're sleepy at the wrong time, but your vital signs, your energy levels, your peak physical strength are all kind of off sync until you get reaccustomated over the next few days. And so when we talk about sleep regulation, in addition to the circadian rhythm, we also develop over the course of the day a pressure to sleep. That's, presents as fatigue or tiredness or, yawning and feeling the urge to go to sleep. And that happens based on a chemical in our brain called adenosine. So over the course of the day, adenosine is released into our brain. And as that adenosine concentration goes up, the pressure to go to sleep increases as well. Over the course of the night, once you fall asleep, the adenosine is filtered out and processed, and we wake up relatively refreshed and ready to go for the next day. And interestingly, this is how caffeine works. So you can see there are some structural similarities between the adenosine molecule that helps signal when it's time to go to sleep and caffeine. So much so that caffeine can actually block the adenosine receptor in our brain and temporarily relieve fatigue or sleepiness. That's a short-term effect until the caffeine is also processed, but that's why caffeine and coffee and other beverages like that help to reduce the urge to sleep. So these two processes work together. One of them is the sleep drive that's mediated by adenosine within our brain. And that, as you can tell on the chart, tends to peak right at around 9, 10, 11 o'clock at night, telling us that we've been awake for long enough and it's time for us to sleep. And then the circadian rhythm. So that cycles throughout the day in 24-hour cycles. We know that that cycle is something that's imprinted on us. It's not just based on the brightness or the daytime, etc., because they've had studies where they've put researchers into caves who are doing other research and monitored their circadian rhythm. They continue to have a regular sleep and wake cycle, even though they're not exposed to any natural sunlight. So we know these two processes together help regulate when and how we sleep. So what happens when sleep goes wrong? Sleep deprivation can look like a few different things. It can be a total sleep deprivation, which is, anecdotally called an all-nighter, right? This is, pertinent for people who are studying for exams or maybe in unusual circumstances. And obviously we've been familiar with that. Short sleep duration is something that's more common. That's essentially not sleeping enough. And that's usually what we run into in clinic is patients who say, oh, I naturally sleep 5 to 6 hours. And that may be true for some people who are outside of the norm, but for most of us, we need more sleep than that. And finally, sleep fragmentation. So sleep fragmentation is people who have broken up sleep quality. These are either, in my line of work, people who are on call for the hospital or people with young children who are waking up throughout the night. And that alone also builds on sleep deprivation and sleep debt. And what are the short-term things that happen when you're sleep deprived? Well, you're increasingly distractible. Your attention for intensive tasks is reduced. You're actually more risk tolerant. You're actually more risk taking, which is obviously not ideal in certain lines of work. You have a decline in working memory and performance. You're more likely to make errors, and you have increased incidence of falling asleep without wanting to. Those gross sleeps. And we know that over time, if this continues, you have even longer term health consequences. And these have been studied extensively. We'll cover some of these, but they include weight gain, development of heart conditions, infertility, a weakened immune system, diabetes and issues with glucose and sugar management, memory and cognitive impairment, and depression or mood issues. We know that over time, these can tend to be associated with sleep debt and sleep deprivation. So talking first a little bit about obesity more in depth. So interestingly, studies have shown that there's a strong correlation between sleep deprivation and poor sleep quality and weight gain. So subjects with short sleep, meaning 2/3 of normal. So this is not 1 or 2 hours of sleep. This is just a moderate reduction, maybe something closer to 4 or 5 hours of sleep. Without prompting, ate an additional 559 calories per day. And we know that biologically, when you sleep less, you actually increase a hormone in your body called ghrelin. Ghrelin is the hormone in your body that your stomach and your GI system produces that tells your brain it's time to eat and that you're hungry. We know that those levels tend to go up when you have less sleep. And over time, you can see trends. So these are not necessarily caused by one another, but are clearly correlated here. So whenever we over time have tracked how long people sleep, that's been going down pretty steadily since the 1940s. People used to sleep anywhere from 8 to 9 hours, and now we're closer to 6 hours. And over that same period of time, for a multitude of reasons, but this may be one, obesity and weight gain in the population has gone up considerably as well. There are also cardiovascular effects of poor sleep and sleep disorders. This can include a propensity to develop high blood pressure, arrhythmias, which are abnormal heartbeats and heart rhythms, such as atrial fibrillation, that require people to end up on blood thinners potentially, and an increased risk of heart attack. There's a very interesting study that's been published that shows that during daylight saving times in the spring, whenever people tend to lose an hour of sleep, there's a higher incidence of heart attacks the day after and the day after that during those periods. That probably correlates to the importance of sleep for heart health as well. And we know that sleep deprivation, we've probably all experienced this, reduces our performance, both of our brain and our muscles and bones. So after 17 to 19 hours awake, when they tested performance of subjects who'd been awake that long, it was equivalent to having a blood alcohol concentration of 0.05%. After 24 hours of being awake, this would be essentially impaired enough to not be able to drive, a blood alcohol content of 0.1%. And we know that sleep deprivation impacts motor skills, attentiveness, risk-taking, and memory formation, as we talked about. And here are these charted. You can see these lines look very similar. And what they're looking at is the performance declining over time, depending on how long you've been awake or how much you've had to drink. And those are actually very similar curves. And finally, a little bit more lightheartedly, it also affects how we look. You know, this is obviously not the biggest deal compared to the other things we've spoken about, but even just in 2 nights of decreased sleep, this study looked at patients who'd had 2 nights in a row of 8 hours of sleep or 2 nights in a row of 4 hours of sleep. And then people were shown photos of these people after those 2 days. So in pretty much every category, an impression of how healthy the person is, how sleepy they are, how trustworthy, how attractive, and how willing you are to socialize with them, it was significantly worse for the group that was sleep deprived, even just for 2 days. So clearly, it's something that's perceptible to the people around us. And so what are some of the tips that we often recommend for sleep hygiene? How do we all incorporate these things to sleep better on a more consistent basis? One of the things that patients will often tell me when they come in is not necessarily that they have other larger sleep issues like we'll talk about with sleep apnea, but that they have trouble falling asleep or staying asleep. And some of the easy things we can do is try to maintain a consistent sleep schedule. So it's very tempting on the weekends, if you have a regular work schedule, to stay up a little bit later. Potentially you're hanging out with friends at that time. But it's nice to try to maintain a consistent sleep schedule so your circadian rhythm, you aren't jet lagging yourself each weekend and trying to adjust. So wake up and go to bed at a similar time each day as possible. Exercise regularly. We know that exercise is associated with many benefits across the body, but namely one of them is improved sleep quality. We know that being physically tired, in addition to being mentally tired, helps you fall asleep quicker and stay asleep longer. Ideally, you don't want to exercise vigorously within 3 to 4 hours of bedtime. As Jean Marie was mentioning with the exercises she was showing, if you do those right before bed, you're going to kind of upregulate your energy levels and stimulate your body in a way that's counterproductive to falling asleep well. So try to exercise sort of in the early hours of the evening or during the day or in the morning. Try to signal to your brain to have a relaxing bedtime routine, and that's time for bed. So historically, we didn't have as many stimulation devices around us in terms of cell phones and TVs and movies and all these things accessible at the tip of at our fingertips, rather. And so historically, when the lights went off and whenever the sun went down, it was time to slow down. And so try to recreate that. Transition to more relaxing activities like stretching or meditation or reading or a warm shower to signal to your brain that it's time to start slowing down. Avoid screens. Specifically, there is some evidence that blue light that we all get exposed to on computer screens or LED screens may stimulate the circadian rhythm and keep you up. Avoid late meals or alcohol right before bed. Those tend to reduce the quality of sleep and sometimes delay you falling asleep. And then manage stress if that's an issue for you. Relaxation techniques or meditation, everybody has something different that works for them. But try to take care of your daytime stressors as early in the day as possible and avoid doing those things right before you go to bed. Additionally, when you go to sleep, think of almost like a cave-like situation for you. You want a cool room. Studies have shown that the ideal temperature may be as low as 68 degrees, which is awfully cold here in Florida and probably would run up your AC bill. But in general, the cooler, the better for patients to be able to fall asleep. You want to make it dark and quiet. So avoid trying to fall asleep to the television. That's usually counterproductive. Try to have the room as dark as possible with, that's safe for you. So if you need a night light, that's fine, but try not to leave lights on or a lamp on as you fall asleep. And then finally, in the current age of cell phones, put your phone on Do Not Disturb so that you're not getting alerts or pings that turn your brain on throughout the night. Additionally, think of your bed as a place for sleep. So oftentimes we see patients who are doing work from bed or like to watch TV in bed or even eat in bed. And those things kind of disassociate your mind from thinking about your bed as a place for sleep. Try to make your bedroom and your bed just a place you go to rest or to sleep. And finally, if you're having trouble falling asleep, avoid clock watchings. because that'll stress you out and that'll make falling asleep a more stressful process and potentially lead to insomnia. If you're unable to fall asleep after 20 or 30 minutes, sometimes go out for a reset. Rather than sitting in bed for another hour, maybe get up, go do something that's not very stimulating, maybe a light little bit of errands in your house, like cleaning some dishes or wiping a table, read a magazine, take a warm shower if you haven't, and try to reset the falling asleep pattern rather than just sitting there and being stressed about your inability to fall asleep. Next, we'll talk about sleep apnea. This is by far the number one thing that we see patients for in terms of sleep issues. And oftentimes, as we're talking to patients, we'll ask them the question of, has anybody expressed concern about the way that you sleep? And even if they're not there for sleep apnea, that often kind of reveals that that's an underlying problem with what they've come in for. So what is sleep apnea? Sleep apnea is repetitive pauses or reductions in airflow and breathing while you sleep. There's two broad types of this disorder. One is more common. It's called obstructive sleep apnea. And what this means is that while you go to sleep, you have relaxation of your throat muscles, including your tongue and your palate, and that can cause those structures to collapse on themselves and periodically obstruct the upper airway so that you can't get as much air in as you need. Central sleep apnea is where the brain fails to send a proper signal to the muscles that control breathing, and you essentially breath hold for a short period. Eventually, in both these conditions, you'll wake up at a subconscious level enough to start breathing again. But this is harmful. So this level of obstruction and obstructive sleep apnea can happen at a variety of different places in the upper airway. Some of the common culprits are the palate or the tonsils, especially if patients have enlarged tonsils or uvulas. The tongue is a really common source. Tongue tends to, over time and with weight gain, fall back into our airway and obstruct our throat, but this can also happen with nasal obstruction or even the voice box. And what are some of the risk factors for sleep apnea? What kind of increases our concern for it, or things that we know are associated with either a higher incidence of sleep apnea or worse severity of sleep apnea? One is weight gain and obesity. As we get older, we tend to accumulate fat not only in the soft tissues of our neck and our chin and our face, but also around the throat itself, putting more pressure and weight on the pharynx, which is the throat. We know that that's tightly correlated with something called neck circumference. So that can be the measure of the shirt that you wear for men. If you wear 16 or 17, you're probably at lower risk than if you're above that 17-inch criteria. Anatomic factors that your doctor can assess: if you have large tonsils or tonsil tissue in the back of the nose called adenoids, if you happen to have a little bit smaller jaw or shorter neck, those put you at risk as well. We know that men are much more likely than women to have sleep apnea, but it's also common in women for sure. And interestingly, about 25% of pregnant women will have sleep apnea at some point during their pregnancy. Increasing age is a risk factor because as we get older, we tend to lose some muscle tone in all of our muscles, including the muscles of the throat. Use of alcohol or sedatives, those can further relax the throat and encourage us to have more apnea episodes. So that can include things like Benadryl or prescription sleep medications, and then nightcaps with alcohol. If you're a loud snorer, that certainly puts you at risk for sleep apnea, and that's probably the most common thing that brings this to our attention. And finally, a family history. So when we talk about the symptoms of sleep apnea, we mentioned snoring already. That's often one of the most common complaints that either the patient or their family member will report to us. If anyone has witnessed you having gasping or choking episodes, so as you go through an apnea episode where your airway is blocked, you have those subconscious wake-ups when your brain realizes it's not getting enough oxygen, and you'll often gasp as you recollect your breath. If you're having daytime fatigue or feeling excessively sleepy, meaning falling asleep on the couch or falling asleep while driving or at work, those are concerns that your sleep quality may not be good. If you're having difficulty concentrating or a morning headache, or you've noticed that you're more irritable than usual without any other obvious cause for that, those can all be symptoms of obstructive sleep apnea. I want to talk for a moment about snoring because this is really closely associated with obstructive sleep apnea. What snoring is when the upper airway is partially blocked during sleep, you'll get vibration of those throat tissues. That can often be the back of the tongue or the epiglottis, which is part of our voice box, but most commonly it's the palate or the uvula. In general, snoring is worse when you sleep on your back. We often encourage patients to sleep on their side or their stomach if they're able to. If you drink alcohol or take sedatives, as we mentioned, or if you have anatomic factors like large tonsils or large tongue, or if you have nasal congestion. That can be allergies or an upper respiratory tract infection like a cold or a flu. All of those tend to make snoring worse. And it's really important to note that snoring is not the same as sleep apnea. It's really much more of a Venn diagram. So there are some patients that snore without having sleep apnea, and there are some patients that have sleep apnea, sometimes even bad sleep apnea, without snoring. And there's obviously the patients who are the classic patients who have both snoring and periodic sleep apnea events overnight. And so when we're trying to differentiate between somebody who has sleep apnea versus not, or somebody who's a snorer versus a sleep apnea patient, we start with a sleep study. There's two different types of sleep studies. One is called a polysomnogram. This is performed in a dedicated sleep lab. Many hospital systems, including BayCare, have sleep labs throughout the community. And this is performed overnight where you come in. It's a little bit more in depth of a test. We're able to get some more data that we're not able to get with a more simplified test. And there's a sleep technician present there to help with certain things. So sometimes this could be things like CPAP titrations that we need to do an in-lab sleep study for when we're trying to adjust the ideal settings of a CPAP, or for more complex patients where we're not just worried about normal sleep apnea. A home sleep test has really caught on in popularity over the past few years. This is a simplified test you can see at the bottom of the slide here. It's conducted at home. It's mailed to your home. It's much cheaper in general. And the apparatus you use is really simplified. So you have a belt around your chest or abdomen to measure how much those are moving and the efforts you're creating to breathe. Around your finger, you have a pulse oximeter that measures your oxygen content. And then you have a nasal cannula, and that measures the effort and airflow going through your nose and your upper airway. And together that can give you a really accurate picture without having to go into a sleep lab. The only sort of caveat here is it's not appropriate for all patients. Some insurances require in-lab sleep studies. And then finally, it can theoretically underestimate the severity of sleep apnea. So if somebody has a negative home sleep study, but we're still very suspicious, oftentimes we'll follow that up with a more formal polysomnogram in the lab. Now, how do we assess if somebody has sleep apnea? What we're looking for is how many times per hour that somebody's breathing slows, which is called a hypopnea, or if they totally stop breathing for a period of time, that's called an apnea. And usually these will last a few seconds, and they're associated with a decrease in oxygen in your blood. So whenever we stratify how severe somebody's sleep apnea we're looking at the apnea-hypopnea index, how many times per hour this happens. If you have between 5 and 15 episodes an hour, that's considered mild sleep apnea. If you have 15 to 30, that's considered moderate sleep apnea. And if you have more than 30, that's considered severe sleep apnea. And the implications on health are different based on how severe your sleep apnea is. So once we've confirmed the diagnosis of sleep apnea and we've gone the sleep study that gives us that information, we talk about what to do next. And so lifestyle changes are a critical part of treating a sleep apnea patient. This is recommended for all patients with sleep apnea, but it can be used as the only treatment for patients with relatively mild cases with mild sleep apnea who aren't terribly sleepy, but this was found on a sleep study. So if appropriate, if the patient is overweight or if they're obese, we recommend weight loss. That's done through healthy lifestyle, minimizing portion sizes, healthier foods if possible. Positional therapy is also helpful. And we talked about this briefly, but we know that not just snoring, but sleep apnea is better if you sleep on your side or on your stomach. That makes gravity your friend and helps keep the airway open, rather than when you sleep on your back and your tongue and your palate tend to fall backwards into your throat. Sometimes we even have to get creative as we encourage people to sleep on the sides. That can be putting a pillow behind your back or even putting a tennis ball taped to your shirt to keep you from wanting to fall asleep on your back. Again, we've mentioned this a couple of times, but avoiding alcohol or sedatives, those tend to make sleep apnea worse. And finally, exercise and a healthy lifestyle in general can help with all of the above, both weight loss and reducing the severity of sleep apnea. You guys have probably heard of continuous positive airway pressure, or CPAP. Positive airway pressure is a mainstay of sleep apnea treatment. It provides a constant flow of pressurized air, and that stents open the airway to prevent those apnea or hypopnea episodes. It tends to help with snoring as well because you don't have that narrowing that typically causes snoring events. It's a first-line therapy. This is often what we're starting with for patients, and it's suitable for all severities of sleep apnea, mild, moderate, or severe. When we get to severe, this is really one of the first-line options that we have to go to. The limitation with CPAP is that it's a little bit of an adjustment, and not all patients do well with it. So for even the patients who do well, we often are trying to optimize what settings they need or what type of mask they need. There's a few different types, some that go just in your nose called a nasal pillow, all the way to the end of the spectrum, which is a full face mask, which goes over both your nose and your mouth. And different patients like different masks, and sometimes it's trial and error to figure out what's most appropriate for the patient. And even with those efforts, only 40 to 50% of patients, only 50 to 60% of patients can tolerate a CPAP, period, with long-term and good success. And when you talk to these patients about what issues they have, they usually mention several things, either claustrophobia, not being able to get used to having something on their face at night, nasal or throat irritation from the constant stream of air that can dry you out, especially if you live in a drier climate than we do here in Florida. Mass discomfort on the face itself can leave indentations or be irritating to the skin if somebody has thin or dry skin. And then finally, the noise can be bothersome to the patient or bed partner. The last non-surgical option that we have for treating sleep apnea is an oral appliance. This is also called a mandibular advancement device. What this does is it's essentially a custom fit mouthguard that select dentists in the community can make for you. And what it does is it pulls the lower jaw forward in comparison to the upper jaw. That helps pull the tongue and the voice box forward as well and creates just a little bit more room in the back of the throat. Even a few millimeters make a big difference here. We know that it's not ideal for patients with severe sleep apnea. It's just not strong enough to treat those patients. And in practicality, I found that even though it's a very appealing option to not have anything on your face, having your jaw in that unusual position chronically for months or years tends to cause either bite problems where your teeth get disrupted or moved out of position, or TMJ problems where the jaw joint gets a little bit of arthritis from being in an uncomfortable position. So in my practice, I recommend this for patients who really can't tolerate CPAP with mild or moderate sleep apnea, or for the patients who travel a lot, who don't want to have to travel with their CPAP all the time. It can also be good for patients who just need to use it at select times, like let's say they're going on a family trip and they don't want to keep their family members up or their friends up if they're going on a trip with friends. And where we often get involved, if those things like CPAP or an oral appliance don't work, is surgical treatments for sleep apnea. In general, these are for patients with moderate or severe sleep apnea. And historically, we did anatomy altering surgery. So surgery to reshape or remove the tissues of the throat or mouth. And we can manipulate the jaw bones or the facial bones, tongue, or the throat and tonsils to create a larger, more open airway. The spectrum of surgeries that we've tried for this over the past 50 years is really broad. We've done everything from a tonsillectomy, which is really common and relatively easy, to palate surgeries, what we call the UPPP. We can reduce the back of the tongue in volume. People historically have done what we call MMA. This is actually resetting the bones of the face in a more forward position to create more room in the throat. And then simpler things like nasal surgeries, so deviated septum repairs or treating allergies surgically to help create a more open nasal airway. That alone is controversial when we talk about how much it impacts sleep apnea care, but it does help you tolerate a CPAP better. If you have a really congested or inflamed nose, you're just not going to be able to tolerate that degree of airflow through your nose. And this is an example of what a UPPP surgery looks like. So here you can see the uvula, which is the dangly thing in the middle of the palate. You can see tonsils, in this case, not terribly enlarged, but often we're seeing much larger than this. And in a UPPP, or a palate surgery, we're going to remove the tonsils, shorten the uvula, and then reduce some of the volume of the palate while also moving it into a more forward position to create more room behind it for airflow. And these surgeries have been effective for a long time, but they tend to be a little bit more painful. So there's been a search over the past 10 or 15 years for alternatives. And that's where something like the hypoglossal nerve stimulator is really exciting. So you may have seen ads for this. The company that makes it is called Inspire. And this works a little bit differently. Rather than removing or reshaping tissues in the throat, it tries to fix the underlying problem, which is tone of the tongue and the throat muscles. So the hypoglossal nerve is the nerve that stimulates the tongue to move forward in your mouth. And the idea here is that when you take a deep breath is when you have peak collapse within your throat. That causes negative pressure, which suctions down those structures. And that tends to be when people get obstruction events. So what this device does is there's an Oreo cookie sized implant that goes under the skin of the chest that senses when you breathe. And in conjunction with when you start to take a deep breath, it simulates the tongue forward in your mouth to open the airway. And this is an approved CPAP alternative for patients with moderate to severe sleep apnea. And we'll talk in a second about kind of what the indications are. So overall, this is appealing because the palate surgeries we talked about or tonsil surgery, those tend to be kind of painful. Some patients even need to stay overnight. The hypoglossal nerve stimulator Inspire is outpatient. It's about 90 minutes or so, much less painful than traditional surgery. The complication rates are relatively low. There's only a 1% major complication rate. There's no surgery within the mouth, which is a lot more comfortable. You can eat relatively normally right away. And the battery life tends to be pretty good. So the battery life is about 11 years. So patients will, if they're young especially, will need battery replacements over time. But in general, that tends to be spaced out enough that it's not too much of an issue. And as this device has gotten more mature over time, it's now MRI compatible, so it won't restrict you from being able to get MRIs like some pacemakers can. And so the outcomes and research over time have continued to point towards this being a really effective thing in our toolbox. Adherence to this is really great. Patients tend to use this almost 6 out of 7 nights per week, which is usually better than most patients with sleep apnea for CPAP. The improvement in the severity, if you remember the AHI, is how severe the sleep apnea is. On average, this will go from anywhere from 29, which is nearly severe sleep apnea, to 6.2, which is on the very low end of mild sleep apnea, nearly cured. And finally, it's not a snoring surgery, but as we mentioned earlier in the talk, snoring and sleep apnea tend to go hand in hand. So the vast majority of patients, their snoring improves. Some patients will still have snoring, but for the overall majority, snoring will improve with the surgery as well. And this isn't perfect for everybody. We have criteria based on previous studies and insurance approval that we look at before deciding if somebody is a candidate for an Inspire or hypoglossal nerve stimulator. You can't be morbidly obese. Normal weight or slightly overweight or slightly obese patients are okay. But we know that as weight increases, the success with surgery tends to go down. You have to be an adult for the most part. And then you have to have moderate or severe sleep apnea on a sleep study within the past 2 years. I'd say as kind of word has gone out about this, patients are coming to see us without an updated sleep study, and that's okay. We often will just order a home sleep study to get done after the patient sees us and decides if this is for them. And finally, the most important thing is this is an alternative to CPAP for those who failed CPAP or just can't tolerate it. Just, have tried multiple masks, haven't been able to get success, and are kind of done with CPAP or looking for an alternative at this point. So overall, just wrapping up here, some conclusions to leave you with at the end of our discussion. The quality and quantity of sleep, I hope you realize now, play a critical role in the overall health of a person. Sleep apnea is often underdiagnosed, especially if the patient is attributing some of these symptoms of tiredness to a busy lifestyle or maybe not being able to rest as much as they would like. But it's a serious medical condition, and it has real health impacts if we don't treat it in time. And the diagnosis and treatment of sleep apnea, not just, allowing you to prevent the health issues that come with it, but can improve your quality of life and make you feel better on a day-to-day basis. Treatment for sleep apnea tends to consist of lifestyle interventions, CPAP, or surgery for select patients. Thank you so much for attending and for being here today. Again, my name is Desai. This is our office locations. We have offices throughout Pinellas and Pasco County, and even Hillsborough County as well. If you wanted to see us, we're happy to see it anytime. I'm happy to take any questions.
Thank you, Dr. Desai. That was awesome. I remember a number of years ago when I met up with Marietta Bibbs, who was with our sleep study institute, and really got to see that sleep affects every molecule of your body, and it's so important to have. We do have a number of questions for you. So if anyone has questions, go ahead and type them into the chat. I will assist in moderating that. But one of them was about, you talked about sleeping on your side. I have to say, I don't think I've heard about taping a tennis ball to your back, but I thought that's a great idea. I'm like, because I
Yeah.
know of someone who needs help with that. But is there a side that's better to sleep on? You know, our organs are on different sides of the body. Are we better to sleep on our right or our left side? I remember being pregnant, them telling me to sleep on a specific side. What's your
Yeah.
thoughts on that?
Not specifically for sleep apnea or for snoring. Some people with acid reflux prefer to sleep on their right-hand side, just as you mentioned with the anatomy of the stomach, to try to reduce some of the liquid sitting right on the esophageal sphincter, but not specifically for snoring or sleep apnea.
And then when you are, the surgeries you were talking about, you talked about sleep apnea, but do they help with the snoring also, if it's not a sleep apnea
It's
necessary issue?
really, really good question. So when we see a patient who comes in with their chief complaint being snoring, one of the first things we'll do is rule out sleep apnea with a home sleep study. And why is that? And this is one of the frustrating things about our insurance systems, but insurance does not consider snoring alone to be a medical problem. Because snoring doesn't have the same degree of impact on your health as sleep apnea does. So treating isolated snoring can be tricky. Now, sometimes there's a role for assessing if people have a separate problem that's a problem in and of itself that's contributing to snoring. So if you have frequent tonsil infections and really large tonsils, doing something like a tonsillectomy can also help your snoring. There's also things like deviated septums or patients with really bad allergies and nasal congestion that certainly make snoring worse. I just saw a patient yesterday who we did a procedure for his nose because his nose was stuffy, and his wife joined him for the appointment and said he's snoring a heck of a lot less. So in those cases, those things may be beneficial for snoring, but treating isolated snoring has and continues to be a challenge because of insurance approval.
Do you have any suggestions about how many hours you should stop eating before going to bed to help promote good sleep?
Yeah, the scenario in which you see this most is discussions about, acid reflux and GERD. So for those patients, we recommend usually at least 2 to 3 hours before bed, not eating a big meal and not drinking tons of water or sparkling beverages right before bed, because those can all kind of distend the stomach and make it more likely to have acid reflux. In terms of sleep, it's not as critical, but you just don't want to go to bed right after eating. So in general, I tell patients 2 hours before bed is ideal and usually plenty.
That is great. Um, Third shift workers, do you have any suggestions and thoughts for those people who are on those shifts where they're up all night?
Yeah, it's certainly a challenging area in sleep medicine. Um, some of the same tips certainly apply, right? Because some of the things we talked about setting up your bedroom for success, making it cold and dark and quiet, are harder during the day, right? There's construction outside potentially, the windows are bright. So certainly trying to replicate nighttime conditions, getting blackout curtains, maybe even playing some white noise or rain sounds to help drown out any ambient noise of cars outside, if that's an issue for you. Sometimes melatonin can help, especially if you're somebody who shifts back and forth between schedules. That's obviously really hard on the body. If you're a chronic night sleep, chronically you work at night, usually your body will adjust over time. We know there are some health detriments even when your body's adjusted, but you try to do the best you can.
With the sleep apnea, can sleep apnea go away on its own? Someone had a study, both in a hospital setting, one showed they did, one showed they didn't. What
Mhm.
could be going on with that?
Yeah, we do see some variability night to night, right? And so it's impractical to get a sleep study every day for a month and average all of those. We do see some variability over time. Most patients, unfortunately, go the opposite direction. Overall, as a population, we tend to gain about a pound a year. And like we mentioned, age is a risk factor for sleep apnea. But I do see exactly what the person mentioned. Occasionally, a patient will have mild or moderate sleep apnea, and we'll get a sleep study the next time, and maybe they don't have sleep apnea. And so we'll assess the patient's symptoms at that point. If they're still really sleepy and still really tired, or somebody's still mentioning that they're snoring or gasping, we'll still consider things like positive airway pressure for those patients, or potentially repeat it a third time if needed. If that was a home sleep study, like we mentioned, that can sometimes underestimate the severity of sleep apnea. So I think they mentioned this was both in a lab, but if it's in a home setting, you may want to repeat an in-lab sleep study to make sure it's as accurate as possible.
If you're having issues with adenoids, what are some of the things you might be seeing?
Yeah, so adenoids are a portion of the body that normally you can't see. It's in the very back of the nose and the top of the throat, an area that we call the nasopharynx. Really, an ENT has to see this either with a camera or with an X-ray. And adenoid symptoms are really nasal congestion, potentially snoring, um, or sometimes feeling mucus or postnasal drip in the back of your throat. And so adenoids are normal structures for kids. Oftentimes, when we take out the tonsils, we'll be evaluating the adenoids if they need those tonsils out or adenoids out. For adults, if there's a concern for this, your ENT can assess you for that and take a look in the back of your nose. And if your adenoids continue to be a problem, we can sometimes try to medically treat it if we think it's related to allergies. But sometimes we have to surgically remove those if they're sufficiently enlarged.
What do you think about the Garmins, the Fitbits, all the other wearables that you wear?
Mhm.
Do you see that those are beneficial for people?
Sure, sure. I think they're likely are beneficial to a certain degree. The accuracy is obviously not as good as a sleep study in terms of how much you sleep, but they generally track, right? They generally track in terms of how much you sleep. Some of the more nuanced things in terms of, some of the devices like Fitbit that report what stage of sleep you're in, that's a little bit more nuanced and it's an educated guess by the device because really they're looking at very simple metrics. It's movement, it's potentially the oxygen level if your watch or wearable has that capability, but it's not nearly even as complicated as a home sleep study. So it's useful information, but it's not, in my experience, enough to diagnose somebody with sleep apnea on its own.
I'm going to ask two more. We're actually a little over time. There are some questions that are a little more personal. I have not asked those about people specific things. If you want, I can get you connected so that you can ask your questions. But we had a couple of questions about narcolepsy and sleep paralysis. Does this kind
Mhm.
of go into that realm?
Yeah, so narcolepsy and sleep paralysis are things that we see. They're not sleep apnea, obviously, but they're other sleep-related conditions. And the treatment of those gets really complicated. That's one of those situations where we may want a polysomnogram, a formal in-lab sleep study, and you probably should consult with either a sleep medicine physician that can be a lung doctor or an ENT in that spectrum, and they can help you kind of manage those and work up either sleep apnea, narcolepsy, or sleep paralysis.
Well, I want to thank you so much for your time and thank you all. I know we had a little sound issue in the beginning, but this was so much great information. If you are having any issues with sleep or have someone who is, I highly recommend that you reach out, if not to Dr. Desai, to somebody else within his group because they are located in multiple locations. But sleep affects every aspect of your life, so you want to make sure you're getting that taken care of. We did record this presentation. It will be shared on our BayCare Present sites. I will be sending out a follow-up from this that has the link to get there. It usually takes about 2 to 3 weeks to get there, depending on how busy our team is to load that up. And we will send you a PDF of this presentation. So the person who was looking for that one image, you will be getting that later today. Have a wonderful day, and thank you so much for being here. We really appreciate you taking your time to share your wisdom and knowledge with us.
Absolutely. Thank you all, and thanks everyone for attending.
See you all next month.